All right, so I have already cleaned the wound, and I'm holding my computer just so we can see a colored picture of it. So from assessing this wound, I can tell that it is a full thickness wound and it has 100% viable granulated tissue. The peri wound is demonstrating hyperkeratosis, and there also looks as to be some rubor on the bottom of her foot, on the bottom towards the medial side of her foot, but I would have to compare this to the other side, to her left foot. The wound edges look to be attached all the way up until about the 5 to 8 o'clock position, but I would have to verify this by actually seeing this in 3D. And then there also looks as to be undermining from the 5 o'clock to 8 o'clock position. And then just assessing the entire foot, as I said, there looks to be some rubor on this medial side of the foot. And there also appears to be some more hyperkeratosis, the callus formations on the first big toe, as well as the head of the metatarsals underneath the second and third toes. So I would go ahead and doff my gloves, hand sanitize, don them again, and then I'm going to go ahead and grab my wound measuring tools to measure the wound. So I'm going to start off by measuring the length, which I would measure from the 12 o'clock position, which would be towards the head, and the 6 o'clock position, which is towards the toes. So I would find the longest length of the wound, okay, so I found the longest length to be here, which is 4.6 centimeters. And then I would go ahead and find the width of the wound, which runs perpendicular to the length. And I would find the widest width of the wound. And so here I have the longest width of the wound, which I found to be 3.8 centimeters. And so from here, if I could measure the depth, I would place my cotton tip applicator inside the wound in various locations to determine which part was the deepest. And so then I would compare this. Once I found the deepest part, I would look at the highest skin edge, place my finger at the location on the cotton tip applicator, and measure it, placing my thumb on the centimeter mark, and then measuring where the top of the cotton tip applicator is at. And then, as stated earlier, that I believe that there was undermining from about the 5 to 8 o'clock position. So to verify this, I could place my cotton tip applicator in a perpendicular position, placing it inside the wound to where I felt an end feel. From here, I could find the depth of the undermining, and to do this, I would again figure out what the deepest part of the location of the undermining is. And so if it were to say about the 7 o'clock position, I would place my thumb where the skin edge was, and then I would do the exact same thing, measure here. Okay, so from here, I'm gonna go ahead and dispose of my wound measuring tools. I'm gonna go ahead and doff my gloves, hand sanitize, and I'm gonna go ahead and document my wound measurement findings. So I found my length to be 4.6 centimeters, and then I found my width to be 3.8 centimeters. All right, so from here, I have already documented all my tests and measures as well as my width and length. So I found the ankle brachial index to be 1.4, and this would indicate vessel calcification. The venous filling time was 20 seconds, and so greater than 20 seconds indicates arterial insufficiency, and 5 to 15 seconds is normal, so it is elevated. She is unable to feel the monofilament in 5 of the 9 plantar locations on her bilateral feet, indicating that she has a loss of the protective sensation on the bottom of her foot, but she does have intact sensation to 5.07 monofilament on the dorsum location of her bilateral feet. The right lower extremity demonstrates equal mid-calf girth measurements as compared to her left lower extremity, showing that she does not have any edema. And then going back to the history of the patient, she just got a new job as a grocery store clerk. So she's standing on her feet. Excuse me. Throat's a little dry. She's standing on her feet for 8 hours a day, something that she may not have been used to since she just got a job. She just got new shoes, so her foot is not formed to the shoes. She's having an increased stress because she hasn't used the shoes. And then she was unable to actually feel her wounds. Her husband was the one who actually noticed the drainage on her shoes, on her foot, excuse me. So, I believe that the upstream cause is diabetes due to the tests and measures that I just went through, as well as the history exam findings. And additionally, the wounds formed in an area of high stress, as well as the callus also formed in an area of high stress. As stated, she has a lack of sensation. She's demonstrating vessel calcification. Her venous filling time showed that she almost had arterial insufficiency. And so this is why I believe the upstream cause is diabetes.